We provide training and technical assistance to community health centers. I've been with the National Center for 7 or 8 years, uh, discussing some of the main issues and providing training and technical assistance to health centers on different emerging health issues such as HIV/AIDS, HPV, STD in general, diabetes, cardiovascular diseases, and all the diseases affecting or conditions affecting public housing residents. My background experience, I am a physician, I am a family practitioner. I've been working with community health centers as well as a chief medical officer. And I've been doing some research on health disparities and on social determinants of health affecting the Hispanic population in the United States. So it's a great honor to be part of this new learning collaborative series, the role of CHWs on teen pregnancy prevention and HPV vaccine promotion in Hispanic adolescent girls living in public housing. And with me is Fide.
Thank you, Dr. Neal. So like Dr. Neal was mentioning earlier, my name is Fide Pineda, and I am the health research analyst here at NCHPH. And basically, part of my responsibilities here is just, to help disseminate a lot of the training and technical assistance activities that we provide to public housing health centers. And part of my background is that I have over 6 years of experience working with healthcare providers, facilitating office operations, working with patients directly. So also for me, it's an honor to be here and be able to provide this type of training to the health centers.
Thank you. Next slide, please. There's one in between. There we go. Thank you. First, some housekeeping items. Remember that we have a platform, Slack, and if you haven't received the invite, you will receive the invite soon. We are planning to upload the videos, all the resources, including the slides and everything that is related to this learning collaborative on a Slack. At the same time, we are going to provide some questions and some polls. So if you can participate and if you can go to the Slack and if you don't have a Slack account, please follow the instructions in the email that you are going to receive. And that's going to help you to be more interactive with the presentations and all the activities that we are planning to do. This learning collaborative is basically like a part 2 of the very first that we did. In case you did not participate in the first activity, we did the cervical cancer promotion, amigas. This is a CDC prevention program specifically for CHWs. And this is a continuation or a sequence or a part 2 of the amigas program because they are somehow related and at the same time provides specific recommendations and specific ideas on how to address 2 important topics affecting teens, Hispanic teens living in public housing. Just as an introduction, again, we are funded by HRSA to provide training and technical assistance to community health centers across the nation, and specifically those serving public housing residents. However, the resources and the materials and the invitations go to the more than 1,400 health centers across the nation. Next slide. This is a live activity. All lines are muted. If you have any questions, at the end, we are going to provide around 10 minutes for a Q&A session. And you can either type your question in the question box or you can use the raise hand icon and your line will be unmuted. Next slide. For this particular session, we have four objectives. We are planning to discuss and identify disparities in teen pregnancy and HPV vaccination among the Hispanic female population living in public housing. We are going to describe SDOH affecting teenagers living in public housing. And we are going to describe risk and health complications linked with teenage pregnancy. And we are very pleased and very honored to have one of the public housing primary care grantees, and we are going to learn from them about a program that they have in place. This is a at-risk youth program addressing some of the issues that we are planning to mention. So thank you. Just as an introduction, there are around 1,400 community health centers across the nation, and 300, this is the most recent UDS data. This is taken directly from UDS. This is 2017 data, and 385 health centers reported survey patients living in or immediately accessible to public housing. Out of the 385, 107 of these health centers are public housing primary care grantees. They receive funding from HRSA to provide health services to the more than 2 million people living in public housing. So let's get started with some of the disparities and issues affecting and social issues affecting public housing residents. As you can see on this slide, we have over 2 million people living in public housing, and 38% of them are children. And this is one of the reasons why we believe, and after having conversation with public housing primary care grantees, we made the decision to present on teen pregnancy and HPV among the teenagers living in public housing. The reason is that 38% are under the age of 18, according to HOD data, and 59% of those living in public housing are female. So as you can see, there is the population living in public housing, in addition to all the social determinants of health, and in addition to all the inequalities that they may have. This is a population that is mostly young, and those 59%, almost 60% of them are female patients. Next slide. In regards to the healthcare needs and the social needs affecting public housing residents, the U.S. Housing and Urban Development released an excellent publication, The Health Picture of HOD-Assisted Adults, and they analyzed data as the CDC data from NHANES, from NHIS, and provided some interesting data about the healthcare needs of those living in public housing. As you can see on this slide, you can see that the rates of diabetes and COPD and asthma and other chronic medical conditions are higher in those living in public housing or receiving or who are in Section 8 or receiving vouchers from HOD. On your on the right hand side, I believe that's the right hand side on your screen, probably it's the left hand side on my screen, you have the use of tobacco in public housing. This is another issue. HUD has been working with health centers in general on the HUD banning smoking in public housing. So there are health centers in general have been working with HUD to address this issue, and if, as you can see, almost 1 out of 3 people, or the 33% of those living in public housing are current smokers. Next slide. This is the other hot publication. This is more towards the health outcomes in those living in public housing, but under the age of 18. The name is similar to the very first one, is the health picture of children living in hot assisted housing. And you can see some of the social determinants of health and some of the issues affecting these children living in public housing. I would like to highlight probably that 66% of them live at or below the poverty line, which is one of the social determinants of health that we are planning to address during these presentations, because poverty is linked to teen pregnancy, and 75% in single female-headed households compared to 27% of the general population. So again, we can see that we can see the need to provide training and technical assistance on teen pregnancy and HPV vaccine promotion. These are 2 issues that, even though if you see the national data, you may say that there are no urgent needs. When you compare minorities with the general population, you see that there is a greater need of providing resources and health education to improve the health outcomes of those living in public housing. Next slide. This is a slide just showing the role of health centers and how we can improve health outcomes by addressing some of the social needs of those living in poverty or having some determinants that are going to affect the health of the population, specifically those living in public housing. So this is just a reminder that patients in general there are 3 circles: the biological circle, the psychological circle, and the environment circle. When you review international data on specifically WHO, the WHO, they say that you have to address the 3 circles in order to improve the health outcomes of those living in this case, living in public housing, but those that have greater needs on the population who probably are not having the healthcare, or are not addressing the healthcare needs that they need to address. Next slide. This again, this is just a reminder of how health centers can position themselves to care for those vulnerable populations. Health promotion is one of the most important ones, as well as community collaborations and addressing the social determinants of health in general. There are several health centers providing or addressing these needs through different programs. We are going to hear from La Maestra, for instance. They have an excellent program at the Circle of Care. I invite you to go to their website, www.lamaestra.org, and look for the Circle of Care and how they address social determinants of health and other needs that the population is in San Diego County in California has, and how they address all these social needs. Next slide. So this is an introduction of the topic that we have, the reason why we believe that there is a great need to provide information So CHWs can work with providers and health center staff to address the teen pregnancy prevention in the communities. Well, so there are several programs that are addressing teen pregnancy prevention in the United States. This one in particular is just educating parents and including parents in the sexual education of the teenagers and the Hispanic teenagers. There are several other programs that we're going to briefly discuss. At this point, we would like to say that we are not going to recommend one in particular. We are going to list some of the programs that you can include or tailor based on the needs that you may have, based on the location of the health center, based on the population that you serve, based on the needs of the teenagers living in public housing. There are two definitions that we are going to mention through the webinar series, and I believe that this is really important to know. One is going to be the social determinants of health definition. This is taken from Healthy People 2020. The definition is the social health determinants include a person's age and the environment in which people are born, live, learn, work, play, and worship. The health determinants affect a wide range of health issues and quality of life outcomes and risks. Now, the rest of this definition is taken from CDC, and this is a CDC explanation. And certain social determinants of health, such as high unemployment, low education, and low income, have been associated with higher teen birth rates, and interventions that address socioeconomic conditions like this can play a critical role in addressing disparities observed in U.S. teen birth rates. We just discussed some of the social issues affecting public housing residents. Unemployment, low education, and low income are part of the social determinants of health affecting this population, and that's the reason why we have some high risk of teen pregnancy in those living in public housing. And the other term that is really important is the health equity definition, which is achieved when everyone has an equal opportunity to reach his or her health potential, regardless of social position or other characteristics such as race, ethnicity, gender, religion, sexual identity, or disability. So these two definitions, you will hear these two definitions through the webinar series, and it's very important just to have a clear understanding of the concept of this definition. Next slide. In regards to public housing data, and this is data not taken from UDS or any other source, this is what health centers are providing through UDS, and there are two particular reasons why we are providing this information. One is the language services provided by public housing primary care grantees. Remember, these are health centers located in or immediately accessible to public housing. And over 31% of PHPC patients are best served in a language other than English. And in regards to the PHPC demographic characteristic by Hispanic or Latino ethnicity, over 41% of patients served in 2017 in public housing primary care are or were Hispanic or Latino. So again, and 64% of public housing and 39% of Section 8 housing households are female-headed with children. So as you can see, there is the need, and this is the reason again why we believe that this is a topic that should be included in the discussions with your staff on how to address these disparities in public housing if you are close or immediately accessible to public housing. Next slide. In regards to disparities in teen pregnancy in general, we have seen a decrease in the number of teen pregnancy, but that's great news. But when you compare data, specifically those from minority populations, then you see that even though there has been a decrease, probably the decrease hasn't been not noticeable when you compare data white white with other minorities such as African American or Hispanic or Asian Americans. Next slide. Again, this is the disparities in teen pregnancy. There has been a decrease, but if you compare Hispanic, the decrease has been around 9%. For non-Hispanic whites, around 8%. But if you compare it with non-Hispanic Asians, for instance, there is a difference of around 6%. But when you compare the total population, the number is around 40%. That's the gap when you compare other minority with the Hispanic population. Next slide. In regards to fertility rates, you see that Hispanics in general are more than 2 times higher, or were 2 times higher than the general population, the other the counterparts, the whites, you know, to have a pregnancy during the teenage period. Next slide. In regards to geographic disparities, as you can see on this slide, those in the south area are more likely to have a pregnancy if they are teenagers. Remember that some of the public housing development and the large public housing agencies are located in that area. And when you compare urban to rural, you see that those living in rural communities are more prone to having a teen pregnancy when you compare it to the large urban developments. Next slide. In regards to the socioeconomic disparities, again, we are talking about low education. We're talking about community violence, insecurity, and all these issues are, according to CDC, linked to teen pregnancy. Next slide. So if we address the social determinants of health, if we address, in addition to all the health conditions affecting teenagers, we are going to improve the health outcomes of some of the conditions affecting this population. At the same time, we're going to achieve health equity and reduce the economic costs of teen childbirth. Next slide. These are some charts taken from some books with, showing the changes through adolescence. This is just a reminder of how female or women change during pregnancy, and this is a really nice illustration when you are planning to discuss any of these changes with the population. This is just, I mean, it's not only for providers, this is just for any kind of conversation that you can include your CHWs in this type of conversations. Next slide. Same for the changes in males. This is another example of how some of these topics can be discussed through health education on focus groups or conversation with teenagers in general in the community. We have had a conversation with health centers. They have groups, they meet on different dates, once or twice a week with the youth population, and the youth are basically participating in this kind of activities, say the kind of topic that they would like to include in the conversations. And these are examples of the materials that you can use while you are discussing sexuality and puberty and pregnancy with the youth population. Next slide. And remember, there are some risks or complication for teenage mothers. You can see on this slide what the medical impact and the social impact for mother and the same medical impact and social impacts for those for the child. So this is remember that there for a teen who is pregnant, there will be some mental health issues. They can have depression or substance abuse or PTSD, or they have other social impacts like lack of social isolation and not completing education, for instance, that are going to affect the health of the females who are pregnant, young females who are pregnant. Next slide. And this is a case that we are going to discuss. We are just presenting the case. In the next presentations for the next webinar series, we are going to discuss the potential solutions. But this is a case of a 14-year-old female who comes to a clinic for a missed period, and her pregnancy test is positive. She initially doesn't want any family member informed and needs to be evaluated and counseled. She's followed through her pregnancy and struggled with the realities of being a teen parent after the delivery. So we are going to discuss what primary prevention programs may have worked for this patient. Next slide. And we are going to have a conversation now on the HPV infection prevention. I will turn it over to Fide. I'm just going to mention the HPV infection is the most common STD in the United States. Next slide. And it's spread through basically sex, oral or intercourse, or vaginal or anal sex, and there has some complications. So anyone can get the disease. Remember that not all who are infected with the HPV are going to have cancer. Some of these conditions may clear, and the person may be asymptomatic, but others can have other complications such as warts and other type of cancers. So in addition to the infection, you can see the genital warts and cancer are the most frequent. However, remember that we are not just talking about cervical cancer. Male patients, for instance, can develop anal cancer, or females and male can also develop oral cancer due to HPV. And now I'm going to turn it over to you.
Thank you so much, Dr. Leon. So now we're just going to talk about really quickly about basically some statistics involved with HPV-associated cancers. So in this slide, we can see that these are all HPV-associated cancers by type and by state. So in the first graph to the left, we can see that cervical cancer is among the highest to have has the highest rate of new HPV-associated cancers. And then on the map, we can see just a little overview about all the states that basically have the highest rates of new HPV-associated cancers as well. So the states that are in the darkest colors, those are the ones that have the highest numbers of new cases. Next one. And then for HPV-associated cancers incidence rates by race and by age, we can see also that in the first graph to the left that unfortunately the Hispanic population has the highest incidence rate of HPV-associated cancers with 9.3 over 100,000. And then on the graph to the right, we can see also that basically the trend of how the incidence rate of HPV-associated cancers, how it happens. So then we can see here that it peaks at ages 40 to 44, and it kind of like stays steady, and then it goes all the way to age 65. So a little bit of the cervical cancer epidemiology. So cervical cancer affects all women. Everybody is at risk for cervical cancer, all women. It occurs more often in women over age 30. And it has been shown that cervical cancer is caused by long-lasting infection with some type of different types of HPV viruses. HPV is also passed from one person to another during sex, and half of sexually active people will have HPV infection at some point in their lives. Cervical cancer is also highly preventable, and this can all be prevented by doing screenings and also through the HPV vaccine. And types of screenings that can help prevent cervical cancer is by doing, the regular pap smears, all that stuff. So in this slide, we're just going to go over a little bit more on cervical cancer, specifically statistics. So here we can see also that that basically the rate of new incidence, the incidence rate of cervical cancer is 7.7 per 100,000. And also that Hispanics are affected the most by by cervical cancer as well, when compared to other races. So here are cervical cancer incidence rates by age and group. We can also see here that the incidence rates of cervical cancer also start from age 20 and goes all the way up to age 85. And this basically shows some cervical cancer mortality rates by race. And one of the things that we can see here is that the mortality rates usually are highest among minority groups when compared to other non-Hispanic groups or white counterparts. And there we can just see where the Hispanic population falls in that bracket. And then on this slide, we can see that the median age at death for cervical cancer is age 58. So this, given all these statistics that we went over, takes me to going over about the importance of the HPV vaccine. So one of the things is that the HPV vaccine basically does is trying to prevent cervical cancer from happening in the first place, at least for the cancers that are caused by the HPV virus. So since the inception of the HPV vaccine, HPV infections and cervical precancers have dropped significantly. And there has been an 86% decrease in HPV cancers and genital warts among teen girls. 46%, there has been a 46% decrease on cervical cancer linked to HPV. And HPV is estimated to cause close to 35,000 cases of cancer, but the HPV vaccine can prevent more than 32,000 of those cancers associated to the HPV virus. And also, who should be getting the HPV vaccine? It is recommended that 11 to 12-year-old boys and girls get protected against cancers caused by HPV infections. And then here we can see a few numbers about the estimated HPV vaccination coverage among adolescents in the US. So since the HPV vaccine was made available, awareness on its importance has helped increase vaccination rates among adolescents in the US. And then in this graph, we can see a little bit how basically how the numbers kind of show the teenagers that have received or that have HPV up-to-date vaccinations. So one of the things about the HPV vaccine is that there is a series, correct, Dr. Leon, that you need to do. they have to complete 2 or 3 series?
Three. It's a three. The patient needs to receive 3 shots. One is day 0, the very first time, then 2 months and a 6 month after.
Okay. So this graph basically shows all the youth that has up-to-date shots that have received all the series in the U.S. so far. Here it shows a little bit about the HPV vaccination rates by state. And basically, it shows that the prevalence in the U.S. has decreased since it has been available from 11.5% to 4.3% in girls ages 14 to 19. An improvement on vaccination rates is still needed to meet the Healthy People 2020 goal. The goal basically is focuses on increasing the percentage of female adolescents aged 13 through 15 years who receive 2 or 3 doses of the HPV vaccine as recommended, and the goal target is 80%. So how does the HPV vaccination address, how can we address the disparities risk factors associated with the HPV vaccination? So one of the things that we can do is provide knowledge about HPV vaccine, which remains low among low-income women with children. Unfortunately, also a large percentage of Hispanic mothers are less likely to have ever heard of HPV, and a lot of it also has to do with language barriers or even having access to care. And some of the proposed solutions to be able to promote the HPV vaccination is in providing educational programs that are specifically tailored to low-income women to increase vaccination, and maintaining consistency with national programs, regulations, and policies and laws.
So there are some issues that I would like to highlight. First, that HPV is the most frequent STD infection. That once a teenager gets the infection, the infection doesn't go away, the virus can remain dormant, and then produce cancer, cervical cancer, oral cancer, anal cancer. This is the only cancer that can be treated or prevented through a vaccine. So there are several education aspects that we can consider where you can include your CHWs, either going to the community and discuss STD in general, or use the vaccine information statements, those that the providers have when they vaccinate patients, and discuss some of the main concerns that the teenagers may have. I'm going to stop for a moment. We are very pleased to have 2 members of La Maestra Community Health Center. They're going to discuss their experience and all the programs that they're doing in regards to these issues and other issues affecting the youth population in San Diego.
Okay, so first we'd like to introduce to you to Noemi Romo. She is the supervisor for Health Education Department at La Maestra Health Center.
Hello. Oh, Cynthia, are you there as well?
Yes, we can hear you.
Okay, perfect. So we at La Maestra try to provide a variety of health education curriculums to all of our patients, and the intention is to educate and capture the needs of all of our patients. We do this through a variety of ways. We go out to the community, we provide group education, also here on site, and we have a couple of satellite clinics where we provide the group sessions along with individual sessions. We provide basic health education, which would include like a nutrition education for adults, for pediatric patients. We do diabetes education and hypertension education. We also provide family planning education where we touch on sexually transmitted infections. We do discuss interconception care, and this is where we promote the vaccinations and also address the HPV. We discuss birth control methods with our patients, and we also are a full clinic, so we provide the prenatal education for our patients. So while the patient is getting her prenatal care with her OB provider, we also are seeing them, our health education department is seeing the patients and making sure that they're getting everything that they need. They have their answers to any questions that they might have, so we coordinate their care throughout their pregnancy. With our education sessions, the first thing we do before diving into educating the patient is assessing the patient. So we ask a variety of questions to identify those social health determinants. And then after doing so, we can connect the patients to the resources found within the community. I think this is a big, this is one of the things that has really allowed us to meet the needs and educate our patients, first and foremost, figuring out what are the social determinants that may be barriers to allowing the patient to achieve good health. So after we do the assessment, then we dive into the education portion of our curriculums. So we educate the patients on whatever they need. And after we complete the educational sessions, we go back and we do reassessments. So we're reassessing our patients depending on what program they're in. We could be reassessing a patient once a month or every 3 months or every 6 months, again, depending on the patient's needs. So I think that assessment is one of the really important parts of our curriculums that we provide for our patients.
Thank you so much, Noemi.
Of course.
Thank you so much for providing. That was very useful information.
Thank you.
Cynthia. Do you have Cynthia on the line by any chance?
She probably needs to be unmuted. She's another panelist.
Okay. Cynthia?
We were having difficulty earlier. We were logged off, and I believe she was logged back in.
All right. In the meantime, let's see if we can get contact with her again. Just as a reminder, our next session is March 17th at 1 p.m. We have some information regarding all the activities and the learning objectives for that session. We are going to discuss the question that we had previously in regards to the case study and some of the potential solutions for or how health center may have addressed that pregnancy in that particular patient. And let's try to see whether we can get a hold of Cynthia again. We apologize for the inconvenience. We're having some difficulties, but I would like to thank La Maestra for providing the information with all the health education sessions and programs and all the good services that they provide to address the social determinants of health in San Diego, California. So we're going to do the Q&A. So if you have any questions, you can either type your question in the question box, or you can use the raise hand icon and your line will be unmuted. And you can ask questions to Fide, to me, or to La Maestra if you have any questions for us. In the meantime, while we wait for any questions, we would like to just remind the audience about the 2020 symposium. This is the Health and Public Housing National Training Symposium. This one is going to take place here in Alexandria, Virginia, June 18th and the 19th. Early bird registration is until March 31st. You can visit our website, nchph.org, if you have any questions, or if you would like to register, or you would like to submit an abstract, or if you are interested in doing other activities such as poster presentation, visit our website where you will find that information.
And then just in addition to the deadline for the call for abstracts is until April 6th.
Any questions? At the moment? All right. You can also visit our website to find information on additional training and activities or publications and past webinars or past learning collaboratives on different topics such as diabetes and cervical cancer, how to address social determinants of care, how to increase access to care. We have right now an ongoing learning collaborative on cultural competency and cultural humility in HIV patients. And information can be, if you go to our website and go to our training and technical assistant tab, you will find that information. Any questions? No questions? You can also visit our website. You can find information on some interactive maps, training manuals, newsletters, information on regional, on our annual symposium, information on issues affecting public housing residents. And you can also visit us.
I believe Cynthia is in the line.
So you can also visit our website to find interactive maps similar to the ones that we use for this presentation in regards to social determinants of health, the smoking cessation, and other issues affecting the population, the public housing resident population. And if you have any questions, please visit our website. And again, this is our contact information. Just another reminder, please complete the post survey. Your responses are essential and give us a chance to review and improve our learning collaboratives and or any kind of training or technical assistance that we provide to health centers in general. So one more time, do you have any questions or do you have Cynthia on the line?
Hello, this is Cynthia.
Hi, Cynthia. Thank you.
Hi, good morning.
You know, and we would like to hear from you, and the audience would like to hear from you about the at-risk youth program and what you're doing to address some of the needs of the population in San Diego, specifically those programs related to teenagers and the issues, the health issues affecting this population. So good morning to you in San Diego.
Thank you. Thank you so very much. I apologize. We were trying to be unmuted and be connected, and I'm excited that we finally were joined together. Um, as part of our big working well together with our community and schools, one of the key components has been through our Circle of Care Services is integrating our community health workers. They play a very integral part of the health of our community, specifically as we're looking at right now at teens and young adults. And with all the changes that everyone is very impacted. So when we recruit for a community health worker, we make sure that a couple measures are met in regards to culturally competent, to make sure that they match the ethnicities and the culture and the background of the people that we're going to be connected with. So with obviously the big challenge with housing and determinants of health, we understand that there's going to be some youth that are high risk, that may be living with family, may not be living with family, working on their high school. So we work closely with these special schools. We work closely with our juvenile court and community schools, which basically are the sites that provide the education to these youth who are at risk. They may have already been in contact with law enforcement, or there may have been a family dynamic that has now created a situation that this youth now lives in a foster home. So we work closely with these special schools, and we bring with us a community health worker that can understand. So it's a peer-to-peer approach, and so that we have a representative who says, I was a youth, I was homeless, I lived in affordable housing, I was living in the shelter, I did make some choices in my young adult life, and now I'm in this situation, but there is a pathway, a road to success, and let me explain to you how. And by having these community health workers who are the liaison between now the community and the clinics, brings that bridge, that connectivity, that trust. They understand me. And so now when we're speaking to this audience, they're listening because now they have one of their own. There's a representative that understands them. So our working abilities with our community, our special schools, our judicial system has required us to have that collaboration and be able to go through those doors and now do the in-reach to those individuals, that we have a great opportunity to provide the health education and also to redirect. And they're going to listen because they have someone right in front of them who understands them. So that's a part that's really important when we are recruiting for community health workers, that they're culturally competent and we're matching the individual to the appropriate audience. So that's one of our approaches. When we go out into these schools, we work closely with the counselors, we work closely with the principals, and we have a very holistic approach in meeting together as a team, creating now the curriculum and finding out first and foremost, what are their needs? What are they looking for? And we do have questionnaires that we want to hear from them directly, like, what are your concerns? What do you need most immediately? And it's 4 questions. You know, are they in a safe place? You know, how much information do you know about health? When was the last time you were seen by a physician? And a lot of times the schools that are special schools are not only the teacher, the counselor, they're the nurse, they're the advocate for this young adult. And so when we come in with a greater force as well. And then we build that trust. And so their ears are open and now they're ready to receive information. And we connect them through our Circle of Care Services, which navigates them through all the services that one would need. One of the biggest network that we've had to develop and strengthen in is our homeless outreach and our reentry approach, as there is obviously a demand for housing, shelter, transitioning homes, and then sober living homes. So when we're dealing with young adults, youth at risk, we have to come in with our our big booklet of resources, because everyone is different and it's not a cookie cutter. You have to be prepared to deal with Cynthia. What are Cynthia's needs today? We want to talk to her about teen pregnancy. We want to talk to her about family planning, but we need to find out a little bit more about Cynthia. So we go in there with our resources and we specialize in dedicating a plan that's specific to them. So now this is a community health worker. We get all the information. We do a soft intake. Then we start working with them, because you have to develop now that relationship. And when you're listening to your youth and a person, they want to know that what time they spent with you, that you listen to them, and then you work with them prioritizing. Obviously, there's certain needs that have to be met more quickly than others, and then we review that plan and go, okay, well, this is what we're going to go. This is what we're going to do. How do you feel about this? Or what would you like to see? And now they have control. And then now, okay, we're going to continue to work. We're going to continue to meet, and then we have that pathway. And so through the ability to have our community health workers working at these sites, and we also create monthly health fairs. And these health fairs is a celebration for their health, for their life, and we make it very approachable. And we have many resources at the table. And we encourage participation. So we make a big fiesta. Here we have our mobile unit that's there with the provider. So individuals, as well as our youth and our homeless individuals, sometimes they're in transition, so we're able to now have an individual to help them navigate, to be seen by a provider, to answer some questions, to provide resources. And we, again, start developing those relationships. That relationship that you develop with that young adult, they become now your brochure, because they go back and they tell their friend and they say, hey, I just spoke to Cynthia, you helped her out and you gave her some clothing, and I want to get tested. And I don't know what's happening down there. And so, again, we start having those, we appreciate, we thank them, we congratulate them on their first step of coming to access services and asking questions. And so that's why I say the community health worker has a really critical part in the community to voice out the information that's available at their language, at their ability, so that they can understand, and culturally competent, so we understand the culture. Obviously, if we have a certain culture that we're assisting, the information is going to be delivered a little bit differently. We have our teams are composed with different abilities to be able to speak different languages. If we're going to be speaking in a certain language, obviously we're going to tap in the right cultural liaison to help us if there's any language barriers, because that happens as well as people are transitioning into the States. They have a culture, and we're very mindful and very respectful. So we have a representative from that culture that speaks that language, so that we're able to convey the information and be able to get feedback as well.
Excellent. Cynthia, thank you so much for that information, for that background information on the use of CHWs, or outreach workers, promoters, or the cultural liaisons, as you NAMAESTRA staff refer to them. This is really, really helpful. Thank you so much to NAMAESTRA again for the participation and the support for this activity. And let's see if there is any questions either for us or for NAMAESTRA one more time.
Oh, I have one question.
All right.
Cynthia, so my question is, let's say if I am a potential community health worker, or I am interested in becoming one, what are some of the things that I would need to do to become a community health worker?
I'm sorry, say again. You're interested in becoming a community health worker?
Yes, let's say that would be my case. What do I need to do? What are some of the steps that I would need to do to become a community health worker?
Okay, so we do have individuals that come and do some internship from college, and we do basically an assessment with them to ask, what are you looking to become a community health worker? What is your focus? What is it that you're hoping to help the community? And we have different individuals that come in and say, I want to help my community. I went to college, or I'm going to college, and I want to know, what do I need to skill myself with? And so when they first come in and they approach us, we explain to them the mission of our organization and how we're dedicated in serving the underserved population. And a community health worker works in many ways. We wear many hats. We're an advocate. We're a connector to services. And so when I share the information and the several departments we support, that's the question of what is your interest? And at that point, there's individuals who say, I want to help with eliminate barriers to access to services. I want to provide more information on public health and awareness. I want to be an integral part of the team program. I want to help connect individuals who are looking for sobriety. So we've had different individuals who come in who have a certain passion, and we try to connect those individuals. So I would ask you, what is your passion in becoming a community health worker?
Excellent. Thank you, Cynthia. That's a great response, and thank you so much. I believe that we are past the hour, so once again, I would like to thank La Maestra for the participation, and to all participants, please remember that we have a Slack where we are going to post all the resources, and I'm quite sure that you are saving your question for the next session. So save them, and if you have any questions, use the Slack. If you have any question for La Maestra, send us the questions, and we're going to make sure that your questions are addressed. Thank you so much. Have a great afternoon and good morning on the West Coast. Thank you.
Thank you.
Thank you.
Thank you.